Okay, great. We're gonna go ahead and get started. Hello, everyone. My name is Stefa Dragoon. I'm the Rural Population Health Program Manager at the Oregon Office of Rural Health. And I just wanted to start off by welcoming you all here. We're really glad you could join us for the first bi-monthly Community Conversations event. We really wanted to host these events to connect with our community of rural partners, share resources and opportunities, and talk about important rural health issues affecting our state. So each event is going to have a different topic. So today we're going to be talking about the legislative session. We're going to hear from Senator Deb Patterson, and then we're going to open up the conversation to hear from all of you. And you can also use the chat and the Q&A function throughout our time together today as well. And then I'm also going to put in the chat the webpage for this event so you can also see the schedule that's on the screen. It's on the webpage. And there is also a survey that you can take to share your ideas about any topics or speakers that you'd like to see us cover throughout the year. Great. So thank you again. And with that, I'm going to turn it over to Bob Dumig, who is the Interim Director of the Oregon Office of Rural Health.
Thanks, Stefa. Hi, everybody. Thanks for joining us. We're very excited to have you with us today. As Stefa said, we really want to make this a regular community conversation. And with the Oregon legislature starting this month, this seemed like a perfect topic to get going. It's also something we can do because of the benefits of our webinar and technology. So while post-COVID, we're probably all excited to be back in rooms together. This certainly does give us an ability to share information and continue to get together virtually and share. And that will be one of the things we'll learn that we can do better with the legislature this time around because of technology. So here's that schedule that Stefa was just talking about of our upcoming topics as well through the end of the year. So if you've got ideas on those, and after we're done today, if you have some thoughts on legislation, on what's going on, or just have some general questions, please, you're also welcome to just email me. My email information will be on at the end of here, and you can also get it off of the webpage. So today I want to do several things. One, a quick overview of the legislature, just kind of how it works, what's going on, some dates about the 2023 legislative time frame, how to track legislation and keep an eye on the things that are important to you. Talk about some of the bills that are affecting rural health, and believe me, it won't be all of them, but it'll be some of them. And then we're going to hear from Senator Deb Patterson. She's the chair of the Senate Health Committee. And the bills that are going to be related to us as rural health and healthcare are all going to go through her committee at one point or another. So we really want to hear from her and her thoughts. And she'll be joining us toward the end. And then we'd like to have your thoughts and questions on what we're talking about today and just general questions. We may move that a little around depending on Senator Patterson's schedule and when she's able to join us this morning. Or I guess it's this afternoon now. So it's not a sunny day in Salem right now, but one interesting thing about the legislature this time is if you were to walk by the building today, you could wave to somebody on the other side by looking underneath, because a lot of the building is basically kind of jacked up and stabilized as they do a lot of work for earthquake proofing, or as much as they can on the old building. So a lot of this legislative session is going to be done virtually. Basically, all of the committee hearings that you're going to hear about and chances that you'll have to testify in the 2023 session will be done virtually. Members are in their offices on some days, not on others, and they will start meeting in the chambers themselves, but they are discouraging attendance at this point from the public, mostly because a lot of it is closed off due to the construction. And I would add, I can't see the questions, but Steph is working with me on those. So if you've got questions throughout this talk today, please feel free to add them in, and I will address them as we go and again at the end. So your feedback is always welcome. So just as kind of a quick background, remember we have a bicameral legislature. We have a House and a Senate. There are two sets of leadership in those. We have a majority leader and a minority leader in each chamber that are actually political positions. And then we have non-political positions in each chamber, the Speaker of the House and the President of the Senate. And under those bodies, they have standing committees. Those committees will change names depending on who's in power and what they want to call them. But they address things like education and healthcare and workforce, environment, commerce, and the like. And then within that, there's also certain statutory committees like legislative revenue, fiscal, legislative council that writes and reviews bills, and then the administration functions of the legislature. And those are all done and staffed and created by, while the party in power has a lot of control over how those work, it is a pretty bipartisan way of operating the legislature. Now, how an idea becomes a law. I'm sure you all remember the good old How a Bill Becomes a Law that was on television on Saturday mornings. And that's certainly the theoretical way that it happens. So a bill gets introduced in either the House or the Senate, and then it gets assigned to a committee. So if it's a healthcare bill, it's going to go to the House Healthcare Committee. And there it gets a hearing by the members, and they will either vote on it to send it out and back to the floor, or they can vote and kill the bill. And they can also refuse to hear it. So there are three things that could happen to a bill in a committee. If they vote it out and send it back to the chamber of its origin, so say if it's a House bill and it comes out of a House committee and goes back, the House chamber can then approve or amend it and send it over to the Senate. And the Senate goes through that same process. And so it takes a little bit of time when you are moving a lot of bills from one chamber to the other, when you're trying to get your public hearings in there, when many of these pieces of legislation have fiscal impacts, and therefore they have to figure out what that means to those that are impacted. And for example, a lot of bills that might have to do with rural health, particular workforce bills, get sent to our office, and we have to look through them and figure out what is the fiscal impact to our office and how we're able to make it operate. Steffa?
Yes, we have a question. Sorry to
Okay.
interrupt. So Sadie Sider said, I was looking at some of the House and Senate bills earlier today. Some of the bills being proposed are the same in the House and Senate. Why is that?
Very good question. That means that they've got support in each chamber. And sometimes what happens is, and oftentimes actually, if you can do it, if you have a piece of legislation that's important to you, and let's just say this is a workforce bill that increases provider incentives for, say, nurses. And I've got some people that support me and will introduce the bill in the House and in the Senate. It gives you a little bit of double protection. So if you have problems getting that bill out of the House, you can work it from the Senate side. So it gives you two vehicles to move your legislation along. They will not, generally, I'd pretty much say never will both of those bills pass. One of them will ultimately be used as the vehicle to move it should it succeed in the end. But it gives you that extra protection in case you have some opponents in one chamber that's a little harder to get it through. But that's a great question. And the other piece is sometimes it's just slower in one chamber. And so the deadlines, and we'll look at some deadlines coming up. The deadlines to get a House bill through will come about before they can get through all of the hearings that they need to, but it was able to move on the Senate side. So it's just another procedural piece that may keep that legislation going. I always say this is a great conceptual document on how a bill becomes a law, because the reality is a lot of legislation goes to committee and dies. A lot of conversations happen about a piece of legislation well before a hearing happens or a work session happens and before it's voted on. And so this is exactly how the process is supposed to work. It just doesn't always go as smoothly as we'd like to think it does. So who are our leaders in Salem today? It should be noted, that 2/3 of the legislature is either new or within their first session. So we have a lot of very new members of the legislature. And that's really important to keep in mind for two reasons. One is they're new to and don't know a lot about the topics at hand. If you're a healthcare worker and you're part of the legislature and you're new, you probably understand healthcare pretty well, but may know nothing about education, environment, revenue, taxes, any of those pieces that go on, or the same if you're an educator or a lawyer. So you have a lot of learning to do. And that means that those of us that are in these other areas need to spend a lot of time with them to help them understand what is important and what's important about the legislation that's before them, or what might be detrimental about a piece of legislation. And for them, it's hard to take a lot of that in. So it's really important for us to make sure that we're doing our part to educate them. The other challenge with so many new people is the most important thing that a leader can do, whether you're in the House or the Senate, on day one of the Oregon legislature, is know how you're going to close that legislative session. What are your ultimate priorities and how do you move through this process? So when the constitutional deadline for the legislature to close comes about, you've gotten to where you need to go, that everybody is happy enough you can get out of the building. So it really is understanding the procedures as well. So this year is going to be a lot of education and a lot of fingers crossed that we can get everybody through where they need to go. So we have a new governor after a very interesting race, 3 women running, two from parties and 1 independent, and a lot of money. So the governor is new. Luckily, she has experience in the process, which will be very, very helpful. Representative Dan Rayfield has been in the legislature a few sessions, and he actually came on as speaker at the end of the last session when Governor Kotek resigned her position in order to run for governor. Stefan.
So I have a question just going back to the past slide from Liz James, asking if there will be a discussion about agency/governor's bills. So where bills proposed by the governor or specific agencies fit into this process. And Liz says, for context regarding the agency bill question, APD has a bill, currently LC 338 LGBTQ plus long-term care bill or rights, waiting for the governor's approval before being assigned a bill number. Okay, yes, just asking that question.
Yeah, let's jump back to that because that's a really great question. So the way the governor's and agency bills come in is an agency cannot submit a bill request unless the governor's office has approved it. Because remember, the agencies all work for the governor, and so it's her priorities that will move forward. So normally what would happen in a governor's race is it would be between 2, and by the time you get to elections, and this is in Oregon, there would be a little bit better understanding who probably is going to win, and that candidate is in a position of lining up staff that will begin to take over as soon as the new governor is in office. Interesting thing about this last race is we had, again, it was a 3-way race and it was tight up to the end. I mean, the reality is nobody was sure whether it was going to be Kotek or Drazen as we move forward. And that meant both those candidates spent all of their time really running for governor and not spending the time that they would normally, or their staff would have normally been, in trying to line up folks that would eventually work for them when they became governor. So, and then the other piece being a new governor with the old one leaving is getting the budget piece together. And the budget is so important to everything else that functions. So that means the governor is not quite where she needs to be overall in all of her hiring. And so agency legislation right now is being prioritized so that the budget issues will come first. And that'll come out next week when she releases her budget. And then as the rest of the staff from the governor's office are in place, you'll start to see a few more of those governor's agency bills moving after it's sort of checked off with the governor's priorities as they go. So They should, over the next few weeks, begin to move, and you'll start to see numbers on those. And a few slides up, I've got a calendar that sort of talks about what some of the deadlines are going to be and when bills have to be dropped. But that's a great question. And if I didn't answer it clearly enough for you, just make sure you put something back in the chat and I'll go back. So Representative Rayfield was reelected as Speaker, so he will remain. And I think having had some experience as Speaker toward the end of the last session was good for him and will help him going into this next session. Senator Wagner has been in, I believe, 2 terms at this point in the Senate, and is fairly well experienced and has been in leadership. So hopefully will be able to do well in doing his work as leader. The funny story I will tell you about Senator Wagner is back in the mid-90s. I actually ran for the Oregon legislature, and Senator Wagner was in college and was one of my chief volunteer coordinators. And so now he's actually Senate president. So, over time, it's amazing where people go. So who else is in the leadership at in the House? In the Senate, we have the House majority and minority leaders. So remember that the Speaker and the Senate President are constitutional officers. They're built in as officers that run the entire Senate and the entire House. Then each party has their own leader. And if you're the majority party, you get a majority leader, and the same with minority leaders. So in the House, Representative Julie Fahey is the House majority leader. And the minority leader is Representative Vicky Brace Iverson. And on the Senate side, it's Senator Kate Lieber and then Senator Tim Knopp. So they both help sort of keep their caucuses in line, if you will, for voting and those pieces, and are also key in the leadership in making sure legislation either moves or does not move. And on that point of how the leadership is working together, the voters last session passed a ballot measure that makes it very difficult, and there are penalties should a party leave during the legislative session. So as you may know, in the past sessions, at one point or another, each of the political parties have walked out to prevent a quorum on the House or Senate floor. And that means business cannot happen. And it was back, I believe, in 2019 that the Republicans walked out during a session and the House could not do business. And therefore, no legislation that term was passed. And it was during a short session, and that meant rebalancing of budgets and sort of cleaning up from the long sessions. And that created a lot of problems within the health authority because they could not reallocate money and rebalance budgets during that time. So the voters said, nope, we're going to penalize people if they do that. So that's not an option going forward, really. But one of the things that is traditionally happens is when bills are introduced, they have to be read. Get to understand what they are and what's in it. Well, now that things are so easily available online and people have access to information, with a 2/3 vote of the chamber, they're allowed to just read basically the relating clause and a description. They don't have to read the whole bill out loud. And traditionally, everybody approves that. It makes the process move very, very fast. Senator Knopp has said that he is not going to support that and that he is going to require that all of the bills will be read completely and thoroughly from word to word on the floor. So we'll see if that stays and whether they'll be able to make some changes and compromise on some ideas. But that's their way of saying, look, we want you to take us seriously when you look at our agenda as well. So that may impact where the time frame goes in the agenda that folks have. Hopefully, they'll get that worked out early, so that there's a little bit more bipartisan conversation, at least on the procedural ends of things. So here's a bit of a calendar for the legislative session. So they officially started on the 17th, and with business. So hearings have begun. And meetings have begun. So, and again, like I mentioned, there's going to be a lot of it virtually because of what's going on down in the building itself. February 1, next week, the governor's budget will come out, and that will sort of help a lot of people understand what her priorities are. That could release some of the other legislation that will be agency bills coming down. And it'll give some people a little bit of an understanding about it'll help give the legislators, the Ways and Means Committee, some idea of what the governor will or won't approve in final legislation. Because what happens with the governor's budget generally is that he or she will put it out and everybody will say, great, now we know what his or her priorities are. Now we're going to ignore it and go over and create our own legislative budget. It's a lot easier to argue for your program in the legislative budget that the Ways and Means is putting together if you're already in the governor's budget. So that's where it becomes really, really important. But the legislative Ways and Means Committee, which is a joint committee between the House and the Senate, will be the ultimate budget bill that goes through. Yeah.
Sorry. So John Curtis asks, with Oregon $500 million short to keep agencies running at current levels, what is the realistic prospects of bills passing that have any fiscal impact?
Yeah, very solid question. If I knew the answer to that, I would be the best paid lobbyist in all of Salem. So we budget biennially. So we will be putting together a budget for 23 to 25, and it will be based on an economist's predictions that will be made in May. So we'll have a lot of conversations about spending and revenue collection that will go through to early May. And that's when we'll begin to hear what those figures are going to be. And then when they release that formally in May, you'll see a big move toward the final budgets that cost money or do tax credits, those types of things based on those predictions. The economy has slowed some, but I think the what was announced today that it still grew at 2.9% during the last quarter shows that it's fairly strong. So I don't know where we'll be in overall spending, but when we talk about some of the bills on workforce related issues, where there's lots of money going toward this investment or tax credits toward that investment, you'll see those start to pare down and narrow down a lot. And we won't, very few of those bills will probably make it forward for that reason. The other thing that impacts our budget is not just this biennium, but they're going to make a prediction about 25 to 27. Remember that we are an income tax state. So voters have always shot down the consumption tax, the sales tax. So we really only have one source of revenue for the general fund, major revenue, and that's income. That's slow to be impacted and slow to recover. So there's a lot of predictions that the 25-27 biennium is going to be a very difficult one when it comes to the budget. And therefore, they're not going to want to spend every dollar they've got in the next biennium. They're going to want to start to keep enough reserves that as things start to change and potentially slow down, that in the second year of this biennium, we are going to be in a strong enough position to keep programs funded and be in a solid position when we go into 25-27. So if we were to fund everything that people wanted at the start, July 1 of 2023, and then we got into the short session in 2024 and found out our revenue was falling short and we had to make cuts. The more cuts you make at the latter end of the biennium, the bigger impact that's going to have on programs. So they really do try to make sure that the spending that they do is something that is sustainable over the 2 years so we don't have to make drastic cuts at the end. A couple other dates on here. Daily sessions, floor sessions will begin on March 6th. So they're not going to do floor sessions really until there's legislation to start voting on. And they're predicting the 6th will be the start of that. If there's, let's say there's going to be some delays and we're going to have to read through every bill and some of these other pieces, they may start them a little early if bills are coming out of the committees fast enough, but chances are that's what they will stick to. The Senate will, in fact, have more floor sessions prior to that because they're going to be doing some approvals of governor appointments to different agencies and committees and those kind of things that will have to take place. One big day is February 21st. So if you were to walk up to a legislator and say, hey, would love to have you introduce this bill for me, I find it really, really important. A legislator can do that up to February 21st. After the 21st, they can't do that. The only bills they can introduce are what are called priority bills, and each legislator will have 5. About this week, I guess on Friday, Monday of this week, when the last came through me, there's about 1,800 to 1,900 bills introduced. We expect that there'll be about 3,000 bills introduced for this session. So that's a lot of bills. And again, they're not all going to make it, but that's how many we'll start with. And that's why I mentioned early on, you really have to know how to close out your session, because you're going to have to start narrowing down those pieces of legislation to get us out of there. On April 4th, it's a work session deadline. So when a piece of legislation gets into a committee and they have a hearing, that's great. You do your hearing and then they're done with it. But you can't pass a bill out until you've opened a work session. And a work session is a formal step in the process that then allows legislators on that committee to talk about it, to make amendments, to make any kind of changes, and then they vote on it before it goes back to the House or to another committee. So the work session deadline is a key one, because if you haven't had one by that deadline in the chamber that your bill was introduced, it's a dead bill. And that's the first line of moving forward. So you'll see a few of those in there. And then the constitutional sine die or last day of the legislature is the 25th. They're hoping to get out on the 15th. I would add, if they don't get their work done and they can't get done by the 25th, they still have to sine die, and then the governor will call them back in for a special session. And that's happened before. If you haven't been to this website, please go. It's a great website. It's the Oregon Legislative website. You can find so much information here. Across the top, you'll see that you can find out information about each of the senators and each of the House members, and you can pull them by district, by party, alphabetically, and then you get to each of their websites to find out the information and contact information you need for them. For bills and laws, you can find out what's been introduced this session, and then you can go back to all the previous ones as well. It'll give you both the actual legislation as introduced and ultimately as passed. You'll find all the amendments that are added in here. You'll find the staff summaries, and you will find testimony that's given on these bills in here. So great way to find out information on your bills. And you can also search by bill number, by bill topic, and by bill sponsor. So again, it's a great place to go to figure out what's going on. The committees, it will tell you which committees are out there, what their calendar is, what the agendas are, and how to join them virtually. So you can sit in on all of the committees virtually and listen. Submitting testimony is really quite easy. There are instructions here on the website on how to do that. And if you ever have questions, please reach out to us. We are happy to help you. It's a pretty simple process, and that you can submit written testimony, or you can sign up to actually give your presentation or your testimony verbally as well. Yeah.
We have a question about if there's a place we can identify all the new legislators.
That's a good question. There isn't one that says, that lists them as new per se. You'd have to go through, pull them up, and see what it would say in there, how many sessions they've been in there, but nothing that you can pull them from that way, sadly. If you're not sure who your legislator is, you can use your address, and this will pull it up for you. You'll see down here is don't want to go to that one yet. Jumping ahead of myself, technology, what the agenda is for today. And it'll also show you, when you go into the location, how you can jump on to the virtual piece of that. So again, a really, really good website, and they've done a great job. This will be our visitor. She'll be back, and she'll be joining us in a little bit. So I'm going to jump forward on this one for a minute. So I put a few pieces of legislation up here just to chat about and give you some ideas about what's out there and what we can expect. We have a lot of focus on workforce this year, and it's both healthcare and non-healthcare workforce. And a lot of people want to do something. Some people don't know really what they want to do. They just want to do something, and they're not sure about what the something that they're offering, what the impact is. Sometimes we get legislation in that's really well intended, but doesn't really work in practice. And then, of course, there's the cost implications. So when somebody introduces a bill, whether it's a tax credit, therefore a tax expenditure, or an actual appropriation that comes through through direct spending, the legislature requires a fiscal on that, and that's where they'll go back and figure out, okay, this bill is going to give a tax credit or a loan repayment. Here's the cost of that during this biennium, and that's both a direct cost and staffing costs, administrative costs, and those pieces. And that'll help the legislature sort of understand whether this is something they're going to want to spend the money on, or maybe if they have the money to spend on. So a few of them there are, one will extend the healthcare provider incentive program to healthcare providers who are students enrolled in health professional training programs leading to licensure for practice nurse, licensed practical nurse, and registered nurse. We all know we have a nurse shortage, so there's several of these bills in there looking at nursing. One of the challenges for things like provider incentives, and this will be a lot of the discussion that goes on, is if we have $20 million for our provider incentive programs, and that's loan repayment, loan forgiveness, medical malpractice, reinsurance, sort of that bucket of programs that we currently do. And we have a set of qualified providers that currently are utilizing those programs. Then you add LPNs, RNs, behavioral health providers that are not currently allowed, all those types of things. And you just add additional providers onto that program with no additional funding. You begin to water down the ability of those programs to be effective. So one of the challenges we'll have with all of the workforce legislation this year is making sure that what passes doesn't just add people to an existing pot of money, but if additional providers are being added, that the resources are there in order to service those providers and make it an effective program. And that means it's going to have a fiscal, and the legislators are going to have to say, wow, look at all these great programs. Which ones are we going to pay for? And that's sort of the devilish detail that we are just now starting to look at and we'll hear about as we have hearings on these bills. So 485 on the Senate side was focused on nursing. Senate Bill 441 focuses on dental. And it's really a very broad one. And it wants to make incentives available to dentists through provider incentive programs, which I will say they already are. One directs a workforce and talent board to create a dental assistance training program. One directs Department of Ed to provide public schools with developmental and expansion programming and to teach K through 12 what those professions are. And one other note of caution that we have in some of this legislation, we already have programs that do pipeline work. The AHEC programs do that a lot in our rural communities, and they're not currently funded to the level they should be to be as productive as they could be. So part of this is making sure legislators understand we don't always need to create a new program. We really need to focus on those we have and fund them so that they're working properly. Yeah.
We have a question asking if these incentives bills are targeted for rural communities only or all of Oregon.
Another great question. Most of them are both. So they're generally described as rural or urban underserved in a lot of the wording in some of these. Some are broad-based and they are for all of Oregon. We're at a point where, particularly when it comes to the healthcare workforce, there is need across the board. So people look at it a little bit differently than they did, 8 or 10 years ago, where I think the focus was more on rural. And I think one of the things that we will work hard, and I think folks, you all in the rural communities, as you look at these and you're talking to your legislators, is to remind them that there is there is need across the board. and including in urban underserved areas. But we do need to continue to make sure we have our carve outs for rural and rural specific programs, because we have the extra challenges of isolation and distance that makes it a little harder to recruit for some of these positions that the urban area doesn't. So if you make all the incentives equal, the rural will often still lose out in that recruitment piece if we aren't targeting them specifically for rural in some cases. So 2928 again is another program that looks at training for registered nurses. Basically, it is the same as 485. So the point that somebody asked earlier about legislation in both chambers, this would be one of those. 2977 is another one, again, looking for ways of distributing money to prepare students to enter the behavioral health workforce. So I think you'll see this session more than some of our past sessions is that there's a better understanding that our pipeline is one of the bigger problems, that we aren't in a position just to offer loan repayment to providers because there aren't enough providers, and it doesn't solve the long-term problem. So we really have to look at what our structural challenges are, because we're not only are we challenged today, but if we don't address those now, this workforce challenge is going to go on for much longer. So again, actually, I apologize. These probably should have been swapped in the way they went out there, because to my point earlier, it's workforce. I just put 9 up here. I have 25 bills on another spreadsheet that I'm tracking, and again, those are just the early pieces of it. And these are some of the tax credits that go on. Again, one of them wants to remove all of the restrictions that have been put on the current tax credit program, just adding nurses, doing more to add mental health professionals to the tax credit. I always say that, from year to year, sometimes tax credits are vogue and sometimes they're not. We spent the last 3 or 4 sessions trying to make sure the legislature didn't take away and completely end our rural provider tax credit. And it took a lot of work. It actually took an urban legislator to come in and save it for us the last time it was really on the chopping block. And this year we have Democrats and Republican, rural and urban, putting in legislation saying we need to do this tax credit and that tax credit. So these are all gonna narrow down again as we get closer to May and learn how much money we have coming in. And then the Ways and Means and revenue chairs are going to say, well, you only have this much money to spend on tax credits. So you're going to have to figure out which ones you're going to prioritize. And that's tax credits across the board. So that's healthcare workforce, that's, economic development tax credits, it's everything. Yeah.
I have my own question about just thinking about how best to prepare for the legislative session, for just thinking about the folks on this call, a lot of different, array of people working in rural health across Oregon, like how to prepare for the session, and also the best ways to engage with the session when we're thinking about bills that folks want to advocate or educate on. Like, what does that look like on a more granular level? And any advice that you have?
Yeah, great question. And there's several different ways. And one really important thing for us, and I think from a healthcare perspective with workforce, we've learned this some time ago, but the workforce that we talk about is no longer just physician, nurse practitioner, and PA, because that used to be the real key point when we talked about recruitment for rural health. Now it's everybody within that continuum of healthcare, from our front desk person, our MAs, our community health workers, all the way up to our physicians. And in many things impact our ability to attract those providers, and that's our community as a whole. So as I mentioned on this slide here, there's some childcare and rural teacher tax credits as well. We have to understand that the discussion that we're having is about how we build a larger, stronger rural community and what role healthcare plays in that. So we need to be looking at childcare tax credit and support and teacher tax credits and supports in our rural communities, because we can't retain our staff or recruit new staff if our communities aren't whole as well. So do know that when we are looking at what we want to support, we have to look for our allies, and we want other people to be our allies. So it's finding those other pieces of legislation and programs in the rural communities that are going to help our communities as a whole. So I think that is really, really an important thing to do. I would go back to yeah, there we go. Sorry. I'd go back to this slide in tracking and the granular level of knowing where legislation is and what's there. This is a great site to do that and know exactly when it's up and how to reach your member. Because things will move quickly sometimes. And so knowing where they are, we all belong to different groups and organizations and professional associations. And many of those have lobbyists and folks tracking this in Salem as well. So I would say reach out to them, find out what you can do through them and what they're following and how you can help play a role in that. If there's a piece of legislation that impacts your site and location, and you're not sure how to who it impacts or how to reach out to our office. We can walk you through those steps to help find who they are. Knowing when a legislator is going to be in the district is kind of important. So emailing a member and saying, hey, we would love to set up a time for you to meet with us when you're in the district. Can you help us out? Can you give us some times? They are generally, and until we get to the latter part of the session when we're really trying to meet the closing deadline, both chambers are trying not to do Friday sessions, which means most of them should be available back in the district. And because a lot of virtual things are going on these days, being able to access them during the week without them being in the district or you having to go to Salem is also increased. So that's a really important thing to do as well. Know that you can do it virtually, but giving them a tour of your site is always very helpful as well. It really brings it home to them. And in weekends and holiday times is a good time to do it. And know that on things like MLK Day or President's Day, I'm not sure that there's one in March, but some of those days the legislature keeps going because they've got so much work to do. So I'm going to do a little bit more on how to contact and talk to your legislator, but our guest of honor is here. So I would like to introduce her. And she might be able to give you some really good tips on how to contact legislators and make a difference as well. So Senator Deb Patterson, thank you for joining us.
Well, thank you so much for the invitation. It's really a pleasure to be here.
So, Senator, we've just been kind of going through a little bit of background about the legislature, your schedule for this term, when you're hoping to get out, what the processes are for bills becoming laws, how to use your fabulous legislative website in tracking bills and finding out when hearings are. We talked a little bit about just a few of the workforce related bills, provider incentive and tax credit pieces, and then maybe how to engage legislators and make sure that you're making contact with them both while you're in Salem and in the district. And so that's where we are at this point. And if you wouldn't mind telling us a little bit about how you see the session going, what the challenges will be, and how you think rural health is going to come out on this end, and any other advice you might have for folks. And Steph is taking questions, collecting all the questions, and may jump in with a question or two for you as well.
Okay, great. Well, thank you so much, Robert. And, I actually think this session is going to be very helpful for rural health initiatives. I made a list earlier today of 14 bills that I think specifically will have an impact on rural health. And if you don't mind, I'd like to kind of walk through those. You've mentioned
Absolutely.
already, and then sort of add how folks can be involved. One that's coming up for a hearing in the Senate Healthcare, and we meet on Mondays and Wednesdays at 1 o'clock here in the Capitol. We're in person and remotely, so you can participate either way. And just to let folks know, if you'd like to testify on any bills, you have to sign up on Oles, and I'll walk through that in a minute, at least 30 minutes in advance. But if you're not able to make the meeting and you watch it and there's something that you'd like to add, please note written testimonies can also be submitted to through Oles up to 48 hours after the start of the meeting. So in other words, by 1 o'clock, 2 days later, you still have the opportunity to submit written testimony for any of the bills that you hear at any of the committees in public hearing, not for informational meetings. Those, just to be clear, just for public hearings. But so next Wednesday, we will be hearing Senate Bill 704, which Senator Manning is the chief sponsor of, related to the forming a governing board to look at to continue the work of looking towards universal health care. I think the reason that this is important for rural areas, it's important for us all really, is that so many folks on Medicare are having trouble finding a doctor, not only folks with Oregon Health Plan. Having a single payer plan could make it potentially easier for all providers to participate, and it might make it easier to find a doctor. Of course, it would be up to the governing board to figure out the logistics of that. I will say that having served rural congregations in between bookending my career in health administration, the cost for health insurance for self-insured families, farm families, and small business owners is really high, and so this could be of interest to families across the state. That's Senate Bill 704. We also are hoping to expand the opportunity for family medicine residencies across the state. That's Senate Bill 490. We're looking at providing health insurance for Oregon State Police who have earned retirements but are not yet at age 65, because we know in parts of the states, the Oregon State Police is the police presence in some counties that don't have a sheriff. And so we'd like to support that workforce as well. Those first responders who do so much for our communities all across the state. That's Senate Bill 403. Senate Bill 549 looks at supporting the work of school-based health centers and getting those across the state, and expanding their work so that they would be able to provide services to family members as well as students, basic health support. The regional health equity coalitions, we're looking to expand those to 2 more regions. That's Senate Bill 564. The community colleges, Chemeketa is leading the charge, but looking at all of them, is asking HEC to expand the offerings. They're currently allowed to offer a Bachelor of Science of Associate, I believe BAS right now. This would possibly expand it to allow them to offer a Bachelor of Science in Nursing, so that nursing students could stay in their communities in more rural parts of the state and earn a nursing degree. That's that's Senate Bill 523. The hospitals, across the state have various financial situations right now. One of the things we're proposing, I'm working with the Hospital Association, in Senate Bill 486, is to pay a per diem for patients who are ready to discharge, but there's no place for them to go and they can't return home. They still need some level of nursing care. And so that hopefully will help to support hospitals in rural communities. The Senate Bill 420 would establish a brain injury resource center, navigation center, which would be a call-in number, not to provide case management, but to provide support related to medical resources that already exist, like at OHSU, the Fabulous Brain Institute, vocational rehab services, housing services. There would be a half dozen or so trained specialists who really are familiar with all the resources for brain injury, both traumatic brain injury and acquired brain injury, available to folks across the state. Working with the Alzheimer's Association on Senate Bill 796, which would extend services for people with Alzheimer's across the state and families through a memory net. again, to reach folks, not just, in near the cities, but everywhere, which is the idea behind this. The dental sealant grant program is Senate Bill 487 to expand the opportunity for folks across the state to have access to those services. And then you've already mentioned the healthcare provider incentives, Senate Bill 485, 484, and 493. I think those are kind of the ones that are most probably of interest to folks right now, although we're continuing the work, of course, on prescription drug affordability as well through Senate Bill 404. Oles, if you just type in Google, if you type in OLIS Oregon, you have to put the Oregon too, else you'll just get some business. OLIS Oregon, there it is. Thank you. And then you can see where things are at. If you click on Oles there, where it says OLIS at the right in the middle, that's it. Then you can see, you can look up things. Let's type on bills. If you click on bills at the top, there's one of the second circle at the top. There you go. And you can choose by three things. You can choose the bill number if you happen to know it, but you're not likely to know it. So then type text. And then if you click on bill text, you can just say you want to look up, say, well, school-based health centers was hard to find. I just tried it because you have to have a hyphen between school-based or it won't show up. There. So it's school-based. Oh, there you go. Yeah. Provider incentives. Perfect. And then it'll show you the bills that relate to that. That is what it, there's one. Yep. So, and then, depending on the language used, there may be different, you might want to try a couple of different things for what you're looking for. And then you can also look, let's go back to bills and now type on bill sponsor, that tab, and go to senators. Then it'll show you a list of all senators and say, oh, just take mine just for an example, Patterson, and then hit choose sponsor. And then if you hover the cursor over a number, it'll tell you, just there you go. You can just scroll down and it'll tell you without having to open them what each bill does. Now that's a really slow way, but it's another way of doing that. Now go into committees. If you could go back to the top and click on committees. And then you can pick whichever, if Senate Healthcare, say, there you go, and it will show you the, now you see on the left, it says meetings. If you click on, that'll show you the meeting for that day. And we had a meeting yesterday. So let's go back to the 26th or whatever yesterday was. Boy, these days are all melding together. Was yesterday the 25th? There we go. Let's click on that. And it'll show you there, you can see the agenda for what we covered yesterday. Now, any of those things that had a public hearing, Senate Bill 189 had a public hearing. So you're still within the time frame of submitting testimony. Click on meeting materials there on the second tab next to agenda. There you go. And it'll show you all the attachments. Those are things that people did send in. And then if you click on the hyperlink to the bill, it'll take you to the actual bill and then you can see where it says register to testify. You can sign up right there. It's there. That's it. It's not right now. It's not, but if a bill schedule, and then you can also hit on testimony, and that'll let you submit public testimony, so written testimony. So, and then if you click on any of the names of the senators, you get our emails. So if we go back to Oles or whatever, anywhere, there you go. Thanks. You know how to do it. Yeah, just there you go. And then just scroll down to whoever if you want to. And we're listed there in alphabetical order, I think, or maybe we're listed. But yeah, let's look at Senator Anderson. And there his website and his email are right there. I would recommend not necessarily calling because he's not in his office every day. I mean, you're welcome to, but you are definitely going to get his attention if you email. He and his staff will be monitoring email, daily, all day. And so that's a much quicker way to get and in writing your question and a response back in writing in very short order. I would recommend don't. I mean, you're certainly welcome to send snail mail, but it's not very fast, obviously. And again, the phone calls are great. Just email first and set up a time so that you actually can connect. Okay. And also, you're welcome to stop by in the building. To be perfectly honest, most appointments these days, because most of the senators are on at least 4 committees and a couple of commissions and task forces and other things. Most appointments are 15 minutes, but we want to hear from you. You're welcome in the building. The meeting rooms are open and the our office building's open. Sadly, the rotunda is not open. There's no cafeteria. There's no coffee. That's
Senator
the worst.
Patterson.
Anyway, and then also remote is an option always.
Can I jump in with a couple of questions in the chat?
Absolutely.
Thank you so much again for being here. We have a question. Do you know of any proposed legislation that might have negative implications for rural health?
Oh, that's a good question. I have to say this time around with so many new people and a new governor, there's a real sense of responsibility to make sure that the entire state is represented, heard, and considered. For example, in the conversation, it's not particularly rural health, but semiconductors, for example, the funding that's coming nationally. There's an absolute commitment to making sure that it doesn't just, that it's includes economic opportunities and housing development across the state. So, and I'm going to quickly grab my thing because I'm about to lose my power. Just
I would just kind of follow up on that, Steph. I think that it's a great question. I think one of the challenges with new people in office also is not understanding all the backgrounds. So sometimes negative things happen just very unintentional. So I think it's important to follow through on the legislation and understand what's happening so that we can help members understand what the impact on rural is if they don't see that kind of thing.
Okay.
thank you.
Sorry.
I couldn't agree more. I was listening as I was sorry. Should have plugged this in before. I was running from another meeting. Sorry.
No worries. I have another question. Emily Knight is curious about the temporary CCO contracting for telehealth primary providers that limits fully telehealth providers to offer services to OHP clients.
I am not familiar with that one. I am going to have to find out. Could you tell me that bill number? Because I'm wondering if it's starting in the House, because I know Representative Nose has like 140 bills in his committee, and I haven't seen them all yet.
We don't know the bill, but I can look into that.
Okay, I'm sorry. Thank you for the heads up. I appreciate that.
And Emily, I can follow up with you because I know she has to get off the call.
Great. Okay. So we've been taking questions. Just I think one may have just popped in.
Yeah, I would love to address that question. Thank you. One of the things, as I mentioned, was trying to get more nurses who live in rural areas to become nurses. And that's why I'm really fighting hard to get the opportunity for students to be able to earn a Bachelor of Science in Nursing where they live or close to where they live and stay and work there. So that is Senate Bill 523, which I'm really hoping that heck will go for that. I know that I know from speaking with some of the college presidents that are 4-year colleges right now, there's some concern there. But I hope we can find a path. Again, provider incentives, the nurse financial incentive, Senate Bill 484, really important to help make the studies more affordable, and then tax credits for nurses to stay and work in rural areas and in other underserved areas are really important too. So I guess that those are, and then you had also mentioned Senate Bill 485, and then you pulled up one on Oles too. That's right, which I wasn't even familiar with. I'm going to find that one too. So hopefully that will help some. But any ideas you have would be great. We really all ideas are needed.
So, Senator, thank you for that. One of the big questions, of course, with all of these provider incentives and some of the other pieces is going to be the budget. And somebody asked about that earlier on. One, we don't know what the governor's budget is quite yet. We hopefully will next week. But what are you hearing for the challenges for this budget year and how it might impact 25, 27 as well? Because lots of tax credit options out there so far this year, lots of increased incentives, a lot of money flowing, but I'm just wondering what the reality you're hearing about the budget.
Yeah, exactly. No, that's a really good question. Given that a lot of money is going to be returned that that in other states would be used to provide services. I think we have to be really mindful that investments need to be made that pay off in the end, and that actually hopefully save money in the end. That's why investing in family medicine residencies that could help to make available more primary care providers in areas where there aren't now would save us money in the long run. Catching things early. The investing in the regional health equity coalitions that would help to support culturally competent care in areas where that's needed. The community college BSN degree wouldn't, the case has been made here at Chemeketa that they're already doing this. The classes that are needed to earn a bachelor's degree, they're already teaching the nursing classes. It's just a matter of rounding out the rest of the bachelor's degree. So as a matter of fact, some of these things wouldn't cost any money at all, any additional money that's beyond what's being spent right now. So yeah, you're right.
It's a challenge.
It's a
Well,
challenge.
and just to follow up, you mentioned money going back, and just to remind folks that the kicker works in the way it works in Oregon is that if we make a certain percentage above what was predicted, that a certain amount of that will go into educational fund, but the rest of it does go back to the taxpayers. So we don't, while the revenue forecast may show a real boom, we don't get that money to actually spend in some. As we are, because I want to be cognizant of your time and others as well. If we could open it, do folks have any other additional questions that they might have for the senator?
I would really like to remind people that you can testify remotely.
And I think that's a great asset when it comes to, what's going on with the tele and the virtual pieces, is it gives access to rural people that didn't necessarily have it before because they can't drive down to Salem. So
And if anyone has questions, I think what we can do is if you raise your hand, I can unmute you. This is my first WebEx webinar, so forgive me for
And you
the.
know what? I am so sorry. I have another meeting that I have to hop off to, but I'm happy to follow up with answers to any questions. And everybody's email is the same. It's just SEN in the center, SEN dot, and then their name, Deb Patterson, at Oregon Legislature, all one word, .gov. So you can reach any of us that day. So
great.
Awesome.
Senator, thanks
Thank
for your
you.
time today. We greatly appreciate it, and we look forward to talking to you in the future.
Oh, have a good day, everyone. Thanks for the opportunity to join you. Thank you.
Bye-bye. So, Stefa, if I can just kind of finish out this slide, just to remind you all, now's the time to get a hold of your legislator. Governor Kotek says she's going to go to every county this year. So she's put up on her website, and the link is here, to host. So she doesn't want to just choose every time she goes to a county. She's looking for people to host. If you've got some opportunity and interest, let's fill out a form and have her showing up at some of our rural healthcare facilities so that she really understands what the challenges are. Let's not forget National Rural Health Day is coming up November 16th. Let's celebrate in our communities. Reach out to us. It's never too early to plan. I am happy to help people pull together some great ideas, and my email is up there. And then we'll go to this one.
Awesome. And we also wanted to, oh, lost the announcements. Okay, there we go. Want to just plug some ORH office announcements. We have the 2023 Forum on Aging coming up in May. Registration is going to open on February 14th. We just released on our website the 2022 Oregon Areas of Unmet Healthcare Need Report. That's on our website, and we can put that in the chat as well for you. And then save the date, the 2023 Oregon Critical Access Hospital Quality Workshop is also going to be May 16th and 17th. And if you have any questions, you can contact Stacy Rothwell on that as well.
Great.
Awesome. Thank
So,
you all.
go ahead, Steph.
Go
Okay, I was just going to say thank everybody for being here. I know we've lost some because the lunch hour is over, but we look forward to having you at the future ones. We will follow up with any information. And if you've got questions, please email us, reach out. We're here for you. So thank you very much.
Thank you all. Have a great day.